is Yasmin. I'm going to be doing a newborn assessment. And so I'm going to go ahead and I'm going to start with listening to the baby's vitals. So I'm going to go ahead and clean my stethoscope with the alcohol pad. And I'm going to listen to the applicable heart rate for a full minute, and I'm going to expect it to be within 120 to 160 for the normal range. And then while I'm here, I'm also going to go ahead and listen to the lung sounds, and I'm going to go ahead and check and see if there's any, if I hear any liquid when the baby's crying, if the airways are patent, and I hear no abnormal lung sounds, they're good. And then I'm going to go ahead and listen to the heart, and then I'm going to make sure that it's in the right spot of the third and fourth intercostal space. And then I'm going to see and listen to if I hear any abnormal heart sounds or any murmurs, or if the beat is, if the rate and rhythm are normal. And it is. Okay, and then I'm going to go ahead and move down to the abdomen, and I'm just going to listen to it, and those are supposed to come within 10 to 30 seconds. And they're supposed to be soft, and you're supposed to be able to palpate and see if the baby has any tenderness or pain, or makes any faces when the baby cries, and the baby cries. And then from there, I'm gonna go ahead and I'll do the temperature, and the respirations are supposed to be between 30 and 60 for the normal beats per minute. So then I'll do the temperature, and the first temperature is always the rectal. And then you want to expect it to be within the normal range of 97.8 or 99 degrees Fahrenheit. And then after that, I'll go ahead and transfer the baby to the scale. And the normal range is 5 pounds 8 ounces to 8 pounds 13 ounces. And then while the baby's here, I'll go ahead and straighten the leg out, and I'll get the baby's length. And the normal length in inches is 18 and 22 inches, or centimeters is 48 to 56 centimeters. And then from there, I'm going to go ahead and I will assess the baby's skin, make sure it's good for her ethnicity, check, and I'm looking for any rashes, any Mongolian spots. The lanugo, usually you have more lanugo with preterm babies, you have less lanugo with full-term babies. Then you're also going to have the vernix, which is the cheesy white material on the baby, and you don't really want to wipe it off because it's good for the baby, and that's relatively normal and it goes away by itself. And then from there, I'm going to check the skin turgor, make sure it recoils immediately, and then I'm going to go ahead and I will assess the reflexes now. So I'll do the palmar reflex, and I'll put my finger in her hands, and then she's just supposed to curl. And then I'll do the trunk inversion, which is just, I stroke one side of her abdomen, and then she's supposed to turn towards that one side. And then any side that is stimulated, the same extremities are supposed to be move. And then I'll do the rooting, which means I'll just stroke her cheek and she'll turn to that side. And then I'll do the sucking reflex and make sure that like she sucks. I can feel the palate from here, the soft palate, hard palate. It has the U shape. I look inside, and the baby's tongue is normal size for the mouth. It's pink. The baby's able to move the tongue freely. I can see that the baby does have a gag reflex, and that she does swallow when she sucks. The cheeks, and then I'll do the step-in reflex, and this is just when you pick her up and they make the little stepping motions. And then I'll do the moral or the starter reflex, and they just make a little scared. And then I'll turn her on her stomach, and this is the prone crawl, so that just means that her head will start to move her body up. And then from there, I'll do the Babinski, and that's when her toes will curl out. And then so I did and then I'll do the pupillary and the blink reflex, so that just make sure that the baby's eyes blink. I can see that her pupils were reactive, they're round, they're within normal limits. I can see that her face is symmetric, her mouth is midline, her nose is midline, her eyebrows are where they're supposed to be, her eyes are really round and they're blue, which is normal for her ethnicity and newborns. And then she has slight eyelashes, her eyelids are above her eye, they're not drooping, there's a slight nystagmus, but that's just because newborns haven't learned to focus yet. And then her ears are symmetric. I don't see any extra skin folds or skin tags, and when you do push her ear, it goes right back. And the baby did pass the hearing test. And her nose, you can, if I push one, she can breathe through it. Push the other one, she can breathe through it. They're very patent. Newborn babies are very, they're nose breathers, so you want to make sure that they're patent. And then I don't see that her neck. I was gonna say something else about the nose. Oh, her cheeks are very puffy, and that when she does the sucking motion, you don't see that they get hollow. So her cheeks are good. She has the slight milia, but that goes away within a couple days. And then I'm gonna check her neck, and it's supposed to be short and midline. Her shoulders are supposed to be appropriated. They're not supposed to be one slightly shorter than the other one. And then I'll feel her clavicle, and I'll just make sure and check for any indentions, any pain for the baby. Okay, and then from there, I'll go ahead and I will do her chest. Oh, sorry, I forgot her head circumference. And with her head, I forgot to assess the head. So then I'll get the head circumference in centimeters, and it's usually the normal range is within 32 to 37 centimeters. And then I will assess for, make sure that it's round, it looks normal. I don't see any cephalahematomas. I don't see any molding, and molding is just when the plates cross the suture line or the fontanelles. I don't see any signs of caput suicidium. The baby doesn't cry or flinch when I touch certain parts of her head. And then on the neck, I don't see any extra skin folds. And then I'll move on to the chest. And with the chest, I'll also get the chest circumference in centimeters. And with the chest, usually you want to make sure that it's usually about 32 centimeters. And then I'm checking again for the retractions. There's no retraction. The baby's expanding bilaterally. I'm going to go ahead and assess the nipples, make sure they're midline, they're symmetrical. And the distance between the nipples are usually 8 centimeters. And then when you touch them, they usually come up, and they about 0.5 centimeters is the length of each nipple. And then sometimes the babies will have liquid coming out, but that's just normal because they're newborns. And then I'll go ahead and I will, okay, so I did her face, her ears, okay, and then I did her eyes, nose, neck, clavicle, chest. I already listened to her heart. There was no abdominal sound. The abdomen I did. The circumference of the abdomen is usually there's not a distinct circumference because all babies are different, but you just want to make sure that you can palpate it, see no extreme distension. The bowel are usually 10 to 30 every 10 to 30 seconds. They're very soft. Then you want to do the femoral pulses and make sure they're patent by you can feel them bilaterally. Then you want to do the inguinal area, and you want to make sure that you don't feel any inguinal nodes. There's no pain for the baby, no distension. And then you're going to look at the trunk, and usually the trunk is wider than it is long. And you want to look at the arms. The arms are usually short, and they'll be flexed when she's quiet. And the baby has all range of movement in her arms and muscle tone. Her legs, they're flexed when she's quiet and she's able to move them. And then if you do this on the baby, you won't hear a pop, which is normal. And then she has her palmar creases right here. She has 5 fingers on each hand. Her hands are normal size. Her feet, they have 5 toes on each feet. She has the plantar creases, and she's able to move them. Her feet are good size. And then her her spine is usually C-curved. Usually has a C curve. You want to make sure that there's no any abnormalities. It looks within normal ranges. And then her body shape in general is symmetrical. There's nothing too big or too small for her size. And then from there you want to check the jaundice, and usually babies will have a little bit of jaundice within the first 24 to 48 hours, but it should go away after that. So it's just a slight yellow coloring on the baby. And then you want to look at their and then you want to ask the mom if the baby has had the bowel movements yet. And usually the first bowel movement is usually really black and sticky. It should happen within the first 24 hours. And then her urine, they usually urinate within the first 2 days about like 2 to 6 times, or they should urinate about 4 to 6 times a day after birth, which is the normal limit. It's usually going to be pale yellow. Sometimes it might be pink, because the females, they sometimes have redness and bloodiness coming out of their vagina sometimes. And then they might have a slight, not really like bad odor, but you can tell that there's a distinct odor. And then then you're going to go ahead and check the genitalia. And for the males, you're going to assess the penis, do the size, check to see if ask if he's going to be circumcised, uncircumcised, look for any redness, any skin tears. And then you're going to palpate the testes, see if they've dropped, see with their size, if they're symmetric or not. The scrotum, you're going to look at the skin, you're going to see the rugae. And then with the females, usually the clitoris is really palpable because it's usually bigger, and the labia minora are usually smaller than the labia majora because the baby's sometimes swollen down there. And then you want to look at the vagina, you want to look at her pelvis, make sure she's good. And then after that, you're going to go ahead and move on to the buttocks, and you want to make sure that they're symmetric, that there's no skin tears, that it's patent. And if the baby has had a bowel movement, then that means that the anus is patent. And then you want to listen to their cry, see if it's very loud, if it's sounds wet, if the baby has any tears coming out. Usually the babies, when they cry, they don't really have tears yet. They just make this squinting noise and they cry. Then you want to check her labs, and with the hematocrit, you want to make sure it's 43 to 63%. Her white blood count should be 10 to 30. The bilirubin should be less than 6. Her blood glucose should be 45 to 96. Her blood type, you want to ask the mom about the blood type. Let's just say she's A positive. You want to ask for blood type and the RH factor. And you want to do the hemoglobin, which should be 14 to 20. And then you want to ask the mom what kind of nutrition she's getting, if she's getting breastfed or bottle fed. And then you want to ask for how often does she eat and the amount that she eats. Is that it? Let me just go ahead and look at my cards. Oh, and then you want to do the PKU, ask about that. Okay. And then you're just going to go ahead and swaddle her back up and go ahead and hand her back to mom. And that is the newborn assessment.